What, in your words, is PRP, and how does it relate to hair restoration?
Okay. So PRP, unfortunately, that acronym is all over the place. Everybody uses the PRP acronym. But the fact is that PRP, platelet-rich plasma, is not the same from one clinic or one device to another. But what it should mean is platelets that are enriched, meaning they're concentrated from the person's own blood. So it's your own blood, and then it's centrifuged down, spin it down, and then you concentrate it. And there are different ways of doing it, but ultimately it's those concentrated platelets that you're going to use to inject, usually into the scalp. And there are different ways of injecting it. In general, the important thing that people need to know is that these platelets contain various growth factors. And it's these growth factors that seem to play a role in hair restoration, bringing back some of the hair that already is there, so hair that's already vellus, that's already miniaturized. So there has to be existing hair, is my impression. I think that if the scalp is smooth bald, you're not going to get much of a response. But if you can use PRP concentration, and if you inject it properly, I think you can get a nice response. Now, it's a temporary response, so that I don't want people to think that you use PRP once, and now if you do get hair growth, that it's permanent. Unfortunately, it's not. The hair will go back to the way it was if you don't keep up with PRP treatments. Now, nobody knows how often those PRP treatments should occur. Nobody knows what the proper concentration of platelets is. Nobody even knows what the proper injection technique is.
Well, when did you start performing the PRPs clinically?
So we started with PRP over 3 years ago, and it's an interesting question you ask, because not only did I start over 3 years ago, but it was quickly that I realized that, you know what, I don't know what I'm injecting, and I started testing it. So I started taking a small specimen and sending it to outside laboratories to see if I was even concentrating the platelets.
Wow.
And we were trying different systems. We were trying different systems at that time. So it turned out, to my surprise, maybe not to your surprise, but representatives of various companies that sell you PRP equipment, sometimes they lead you, or they tell you something that isn't quite right.
No.
So when we actually tested,
Say it's not so.
it's hard to believe. Hard to believe. So when we tested various systems, we found that there was a wide variance in what concentration you could get with the PRP, and that led me to believe that that could account, but not had to be the only reason, but could account for some of the variability of response that we've heard in various reports that people have published. So what's the difference? Why are some people getting positive response, other people getting a negative response? Well, maybe one of the reasons is we're not all talking about the same system. We may have different systems. We may be concentrating differently, injecting differently. We're just not all on the same page.
Do you use this as a regular part of your clinical treatment?
There are some women who probably we push a little bit more to consider PRP, because, you know, in women, oftentimes they don't have great donor to use in the first place. So anything you can do to help them medically before considering surgery, or maybe even with surgery, is useful.
What are the risks of PRP? Do you have any concerns when you offer somebody PRP?
Sure. So the only adverse reactions we've seen are it can feel warm to the patient. Sometimes pruritus can occur. A little bit of edema afterwards, maybe a little bit of discomfort afterwards. I suppose there's always the possibility of an infection. Thank goodness we've never had one. But I think overall PRP is very safe.
Yeah,
there seems to be more problem getting the blood than injecting PRP.
Yeah, one of the great things about the scalp is that you almost never see an infection. Never seen an outright infection of scalp.
Yeah,
a couple of pimples.
Great vascular supply.
Yeah. What about multiple PRPs? Doing it again and again and again. How far apart would you spread them? How many times would you do it? Is there a maximum number of times that you would perform a PRP on somebody?
Yeah, so I think that's a great question. And I think that the answer is unknown. I think most of us are going by intuition more than we're going by scientific data when it comes to protocol. So I'll tell you what we do. So if we do a PRP for a patient, we would probably wait about a month and maybe do a second PRP, and then several months after that and see if they're getting a response. If they're not getting a response after 2 treatments, then I would be disinclined to try it again. I would offer the patient the opportunity to perhaps wait a little bit longer and try it again. But I think if you're not responding after 2, maybe 3 times, then I would not push my own patients to do it. I'm sorry, I don't have any published data to support anyone's position on it.
Yeah, nobody's, as far as I know, has published much on this. It's mostly anecdotal. And the problem with our field is we're practitioners in clinics. We see a patient a day, 2 patients a day. That's not enough to build a huge study around. There's too much variability, like in your experiment.
I wanted to also convey that we've used PRP for atrophic scalps. And before we've done a transplant or done something like that. And we have found that the dermis increases and the vascular supply increases so that they accept grafts better. And I haven't done a biopsy.
That is a great idea.
That is a good idea.
That is a great idea, because we run into that problem too. And what can you do? That may
put
actually
in PRP.
Great idea.
And wait a few weeks.
And you really should. That's worthy of another study.
So that's what we've done. I've even done it with people where skin is on the periosteum.
Yeah, you've had those too. Those I've turned them away.
Radiation burns, people who were treated for fungus many years ago and got treated with radiation or something like that.
That is a brilliant idea. That's why it's called the practice of medicine. Is it possible that any of the benefits that you've noticed are really coming from normal cycling of the hair, changes in hairstyle,
Sure.
changes in length?
Yeah. So again, I think that's a viable argument. I think you could bring up those criteria, parameters. I think is reasonable. However, we do hair checks, with measurements, and then of course we do photography, and there does seem to be a clinical and objective improvement in our patients, which we could demonstrate to patients and obviously to you but I think your point is well taken. All those other things need to be considered. If you don't take the photograph the same way, if the hairstyle isn't the same, you easily be misled.
You had talked about the use of a yellow top tube and doctors using it as a poor man's PRP. What is the yellow top tube generally used for, and why is it a problem using that as a poor man's PRP?
So off the top of my head, I don't know what yellow top is actually used for, but I do know that the F says that any of these tubes that you're using to collect blood in should not be used to take material out of and then inject into a patient. And I don't know where it is in the literature that says that. I was told that a while ago by someone. They showed me something from the FDA, but I could probably get you a reference that reiterates the FDA position on this. The problem here, I think, is a legal one, that if, God forbid, something happened with your patient and they had a contaminant in that tube, I think it would be very difficult for the doctor legally to defend him or herself when the FDA has clearly stated you shouldn't be using these tubes for this. Actually, I think even Becton Dickinson, who makes the tubes, or one of those companies, has put out something to that effect.
Thanks for your time. You made your point that if you're going to do PRP, use an official and recognized PRP kit, and just understand that not all PRP kits are created the same. If anybody proved that, it was Rosa Nussbaum in this article right here, which every hair transplant doctor who wants to offer hair transplants needs to read and appreciate. Thanks for doing this, and thanks for the interview, Dr.
Thank you
Rose.
so much, and thank you for your input on the FUE donor mathematics too. I really appreciated that.